Hello and welcome. This is Abigail Perillo from the CHESS Program Development Team. We'd like to thank you all for listening in on this CHESS webinar, Influenza, Know the Facts. We'd also like to thank Sanofi Pasteur for making this webinar possible. So today we will identify the appropriate time frame to get the flu shot, explain the importance of the flu shot, and describe conditions that make individuals more susceptible to complications. As well, we will identify the alternative to the flu shot if one is allergic to the vaccine ingredients. And now I will turn the presentation over to Dr. Gardner.
Hi, I am DeDe Gardner. I'm a respiratory therapist and also an associate professor at the Department of Respiratory Care at Texas State University in San Marcos in Round Rock, Texas. My experience with the flu has been personal. I've had a brother-in-law who has passed away from the flu, and also professional, taking care of patients that had chronic disease and ended up being those high-risk patients in the ICU and having to be mechanically ventilated or placed on ECMO. So I find that this is extremely important for the public. So we want to make sure that we are promoting facts and not myth. So patients need to get the flu shot, and we need to ensure that they know when to get the flu shot. So the flu shot normally will not give you the flu. It contains an inactive virus and cannot do that. Most likely patients may have a soreness in the arm where they receive the vaccine, but it is best to have the flu shot prior to Halloween or the end of October. Do we really need to get it again? Flu season does occur every year, and if you've had the flu this year, you should still get the flu shot next year. And that is because of the different types of strains that exist with the flu itself. And the flu vaccine is not a guarantee that we won't receive or end up with the flu. It is likely that if we do have a flu vaccine, get exposed to the flu, have the flu, that our symptoms of our illness will be reduced. And then for those of us that feel that we are invincible and never get sick and don't think that we need to have the shot, ideally everyone needs to have the shot. Everyone who is able to have the flu vaccine should have that done because it doesn't only protect you, it protects your loved ones and the rest of the community, especially those that are not able to have the flu vaccine, such as someone who has cancer or a baby that's less than 6 months old. So just by you and more people having the flu vaccine, we are protecting our communities. Working with patients that have chronic obstructive pulmonary disease, even if the pulmonary disease is in control with medication, it's still important for these patients to have the flu shot. And the reason for that is because these patients are at high risk for worse outcomes, such as developing pneumonia or being admitted into the hospital, emergency room, or even ICU. And so even if your chronic disease, such as COPD, is under control with meds, you still would benefit from having the flu vaccine or the flu shot. For those patients who are allergic to eggs, it would depend on what type of severity of your reaction is to eggs. So it's important to know if you have hives after being exposed to eggs, then the studies demonstrate that you probably would be safe to have this type of flu vaccine. However, if your reaction is severe, then know that there is an egg-free alternative called Flublok quadrivalent or Flucelvax quadrivalent that is available for those patients that have severe reactions to eggs.
All right, well, thank you so much, Dr. Gardner, for a great presentation, and thanks for everyone for taking time out of your day to listen in.